Hai, Assalamualaikum warahmatullahi wabarakatuh. My name is Fatina Bila binti Fasil from Bachelor in Medical Imaging Cohort 21B, and my nomenclature is U6250017. Today, I would like to present about my topic is radiation safety challenges in pediatric nuclear medicine in under subject radionuclide imaging. And our lecturer for this subject is Madam Nur Fasliana Muhammad Fazil.
So, for the introduction, what is pediatric nuclear medicine? Pediatric nuclear medicine is a medical imaging technique that uses small amounts of radioactive substances called radiopharmaceuticals to diagnose or treat disease in children. It plays an important role in detecting abnormalities in organs and body systems such as bone, kidney, thyroid, and heart. However, children are more sensitive to radiation compared to adults. Therefore, radiation safety is extremely important to ensure effective imaging while minimizing radiation exposure. Okay, next, why radiation safety matters in children? Radiation safety is more critical in pediatric patients because, first, children have higher radio sensitivity than adults. Next, their organs and tissues are still developing. Third, rapid cell division increases vulnerability to radiation. And fourth, longer life expectancy increases long-term risk. So, these possible effects to patient increase risk of cancer, tissue damage, long-term biological effects. Then, children are not simply or small adults and require special consideration. Main radiation safety challenges. There are several challenges in pediatric nuclear medicine, which is we have equipment and protocol limitations, parents and caregiver concern, communication and cooperation issues, dose optimization, staff radiation exposure, and patient movement during imaging. All these challenges can affect both patient safety and image quality. The first challenge is dose optimization. Dose optimization means giving the lowest radiation dose possible while still obtaining high quality diagnostic image. The challenges, which is overdose, increase unnecessary radiation exposure. Next, underdose may produce poor image quality. Last, dose calculation is more complex in children. So, for the solution, healthcare professionals use weight-based using and follow the ALARA principle, which means as low as reasonably achievable. The second challenge is patient movement. Young children often have difficulty staying still during image procedure. This common cause fear, anxiety, pain, or lack of understanding. Because of this, they may move during the scan. The effects can be motion artifacts, poor image quality, need for repeat scan, or additional radiation exposure. To reduce this problem, we have three solutions, which is the staff can create child-friendly environment or use immobilization device to interact the kids. The next challenge is communication and cooperation. Communication can be difficult in pediatric patients, which is the challenges is children may not understand the instruction, fear of unfamiliar equipment, and anxiety during procedures. So, to improve these strategies, we can use simple language, explain procedure clearly. The workers should build trust with children and parents, and provide emotional support. Good communication improve cooperation and reduce stress. Staff radiation exposure. Radiation exposure also can affect healthcare workers. Healthcare workers are exposed to radiation during preparation and administration of radiopharmaceuticals. Risk factors, which is frequent radiation exposure, close contact with patients, handling radioactive material. To reduce exposure, these three protection principles can we use, which is minimize time, maximize distance, and use shielding. These principles reduce occupational radiation exposure. Parent and caregiver consent. Parents are often worried about radiation exposure and safety. They may ask whether the procedure is safe or if radiation can cause harm. Common concern. Is radiation harmful? Is the procedure safe? Will there be long-term effects? So the solution is healthcare workers should provide clear explanation, educate parents on benefit and risk, reassure them about safety protocols. These help reduce fear and build trust for their parents. Proper education help reduce fear and anxiety. Strategies to improve radiation safety. There are several ways to improve radiation safety, which is follow ALARA principle, use low-dose imaging protocols, ensure staff training and education, perform regular equipment quality control, improve patient preparation, and educate families and caregivers. These strategies help balance safety and diagnostic effectiveness. Future improvement. In the future, radiation safety can be improved with better technology. For example, advanced imaging technology, low dose radiopharmaceuticals, and better pediatric imaging protocol. AI technology may also help improve image quality while reduce radiation dose. In the conclusion, radiation safety is essential in pediatric nuclear medicine. Children are more sensitive to radiation and require special protection during imaging procedures. Despite several challenges such as dose optimization, patient movement, and communication barriers. Also, proper safety measure can reduce risk and improve diagnostic outcome. Radiation safety should always remain a top priority in pediatric nuclear medicine. So, these are my reference. That's all from me. Thank you.